This is the appointed time. We have just formed a quorum, so I call this meeting to order. First, we need to discuss the work of the Joint Subcommittee on long-term care policy. There are still outstanding issues, and the House Committee would like to know whether we want to extend the work of the subcommittee. And I've given a checklist for members' reference. We have over 10 subjects for discussion, and that's in CB bracket 21712/1617 bracket 01. I won't go through the list of over 10 items for discussion, but if members agree about these 10-odd outstanding items, I would recommend to the House Committee for an extension of the Joint Subcommittee's work so that we can finish our discussion, so that we can extend after July until the end of November 2018. Any views on that? Do we agree? So if we agree, then this will be done as planned. And let me invite the deputations and the administration in. Moving on to the agenda proper, on service quality of private residential care homes. So, may I welcome from the administration Ms. Stella Zhang and Ms. Pun from the Labour and Welfare Bureau. From the Social Welfare Department, we have the newly appointed Assistant Director, Ms. Wong, who is in charge of licensing and regulation, and also Ms. Rosemary Guan and Ms. Lau. Well, welcome. Today we will discuss residential care homes service quality, including the private RCHEs and RCHDs. Residential care homes is very important in Hong Kong. I don't think the disabled and the elderly would like to be sent to a home. They would like to age in the community and live in the community and be as close with their family members as possible, so that they can continue to live in a normal environment. But sometimes when care is needed or when there is a lack of community support, we have no alternative but to opt for residential care homes. For subvented homes, the quality of which is relatively better, the waiting time is very long. For elderly, the waiting time is about 3 years, and last year there are so many elderly people who died whilst waiting for a place in the RCHEs. The situation is even more dire for RCHDs. For the disabled, they may need to wait for 17 years, and for physically disabled, they need to wait for 15 or 16 years. This is such a shocking figure. Many people have no alternative but to turn to private care homes. In 2015, we had the incident of breach of rehabilitation, or the Cambridge nursing home in Tai Po, and in 2016, we had another incident happened in breach of rehabilitation nursing home. In terms of legislative amendment which seeks to improve the quality of private residential care homes, our progress is very slow. We thank the deputations for coming and expressing their views on this subject, because this is an important subject that involves everyone. Everyone will become old and everyone may become disabled one day, and our family members may also face the same difficulties. So we need to prevent the reoccurrence of an incident like the breach of rehabilitation. And in today's paper, the administration has set out over 10 measures in improving the service quality of private homes. But in view of the time we have, I'd like to allow deputations to speak first. We in the past already discussed the subject, and there were also media reports in which the administration were able to explain to the public their progress. I'd rather give more time to deputations and individuals to express their views and also follow up on the administration's response. So I will invite deputations to speak first, followed by a response from the administration before I open the floor for members to ask questions. I need to remind members that, or deputations, that you have a speaking time limit of 3 minutes, and your speeches and submissions are not protected under the Legislative Powers and Privileges Ordinance. So you're responsible for your own statements, and please try to observe the speaking time. And this meeting will be adjourned at 7 p.m. We have already extended the scheduled meeting time. First, Civic Party, Mr. McChicken. For private care homes, all along there have been a lot of problems. For example, overcrowdedness, poor quality of food, and employment of illegal workers. And quite often we hear about cases of elderly abuse. It reflects the poor quality of private care homes. The government claims that every year they will inspect a home at least 7 times a year, or 5,000 times in total. But why is it that these problems are not tackled or discovered? Is it because the government is turning a blind eye to the problems? The poor quality of private care homes have to do with a lax monitoring effort on the part of the government. There are no clear service or performance indicators on different areas such as environment, hygiene, facilities, quality of staff training, fees, and quality of food, etc. There is no standard imposed for monitoring. There are over 5,000 homes in Hong Kong at the moment, private homes, and many of them are not meeting the required standards, but the government allows these homes to continue their operation. The government has not reviewed the relevant laws for many years. And comparing to other jurisdictions, our laws in this regard are far out of date. And in terms of the staff ratio in Taiwan, the ratio is set at 1:20, but in Hong Kong it's maintained at 1:60. So in terms of carers or nursing staff, we're in great shortage. In UK and Japan, and the per capita space is over 10 square meters, whereas in Hong Kong it's as low as 6.5 square meters. We understand how crowded the care homes are, and sometimes it is also very stuffy. The Civic Party believes that apart from increasing the subvented places, the government should also immediately review CAP 459, our CHE ordinance, and the subsidiary legislation to enhance monitoring on private homes, and also fully review the requirements on facilities per capita space and service flow and staff deployment of care homes. There should be clear service indicators and provisions on the penalties to improve the service quality of private care homes. Second point, we request that the RCH ordinance be amended, because at the moment there is no provision on any criminal offense on elderly abuse and penalty. We need those. And finally, we hope that the government can take the lead in improving the pay for staff in care homes so that more job opportunities can be provided to attract new blood.
Mr. Choi of JB. The government for many years has advocated aging in place as the priority and then offer residential care home places as a backup. But some elderly people are frail and their family members cannot take care of them. The government, society should provide proper care places for them. But the waiting queue for the survivor homes is more than 30,000. Average waiting time is 2 years. So with limited resources, elderly people are forced to move into private homes. But like many others, the quality of survivor residential care homes is a matter of huge concern. Former Labour Secretary Jiang Qinchong said over the past few years, the licensing office of the SWD received about 300 complaints against homes every year. 40% of them were related to the quality of care, 15% were related to management, staff deployment, meals, environment made up 10% respectively, each of them. So the quality of private homes vary widely. Besides, the fact that some survivor homes are given more subsidy to ensure better quality. Most homes, however, run in the private sector, rely on the CSSA and subsidy of the long-term residents, which is about 10,000 per month. And because of the soaring rents, you can't imagine the quality of service at these homes. And therefore, there have been much criticisms against it. Therefore, early this year, the government launched a voucher scheme to adopt the principle of money follow the user. We support the scheme, and this should give homes more resources and improve their resources and quality through competition. But to avoid the operators pocketing all the resources without benefiting the elderly, the government should really stringently carry out more inspections and step up monitoring. And the non-compliant homes should be heavily penalized. And the government should also closely follow up on complaints against homes. DAB also proposes that a development fund be set up for the homes so that the quality residential homes in the private sector can be given one-off subsidy to help them enhance their quality and facilities. For example, their internal use of space could be improved, and we can use civic wisdom to develop all sorts of technology and care methods. For example, there can be better toilet facilities, and also other facilities to help elderly people have better care, and there should be better drug management system to help those who cannot walk properly rely less on their carers and also ease the pressure facing frontline staff. Thank you. Next one, Concerned Group for Home Care Services Alliance. Mr. Kwok. Thank you. Residential care homes for elderly is very important because elderly people have to rely on the homes to spend the last years of their lives. Therefore, the quality of residential care homes have direct impact on them. Our alliance thinks that the quality of homes with board places is dubious, and they could not really meet the needs of the elderly people. You need to have quality of the category 1 homes to ensure that the elderly people are given good services. So often you need to make sure that they go to the right homes. The government's monitoring of board places is very weak, and neither are there clear service assurance. The government should face up to the root of the problem and understand the needs of the elderly and build survivor homes with the proper staff-resident ratio so that the residents can be given proper care instead of pushing all the demand to the private sector and blindly trying to solve the problem with market forces. the first stage of healthcare voucher scheme is actually inflated. It really leads to a large number of private homes, putting elderly people's lives at risk. There are 250 places for the first phase of the pilot scheme, but the homes participating in the scheme can offer 574 places, and yet the situation is inflated. Some homes claim to provide 63 places, but indeed they're not offering any extra place for elderly people. And there have been so much complaints against private homes. How can elderly people be confident about moving into those homes? Lastly, I want to say that the speed or the pace of work of the working group on amending the legislation is too slow. They have to use 2 years to review the situation. I think now with the plight that many elderly people are in, 2 years is too long. I think we need to really expedite the legislative amendment work. Thank you. Next one is Ms. Lau Hoi Lam. Thank you, Chairman. In terms of the quality of private homes, well, this is not a new issue. We've seen that every time only when there was a major scandal uncovered, then when people really pay attention to it. But all along, elderly people actually always have doubts about the quality of private residential care homes. But the residential care homes and also the community care voucher scheme is biased towards the private market. But you can see that the private market is not totally or necessarily reliable. We are totally against allocating the responsibility for caring for elderly to the private market. We received a neighbor's complaint who used the community care voucher to get a bed place for the elderly person. Each day it costs $410. Even though he had the support of the voucher, but getting a voucher to find a place doesn't mean that the elderly person is given adequate care. In the beginning, they were told that there could be rehabilitation activities and daily small group activities, but in all the days when the elderly person was living in the home, she had never participated in any activity. There was no activity arranged for her, and the Central Working Group never dealt with their complaints. Therefore, you can see that whether it's the community healthcare voucher or the home included in the program, even if the staff ratio meet the minimum standard, their standard of service is dubious. Various private homes have accepted the vouchers, and yet the service, for example, the rehab exercises, they charge $710 per hour. So we are offering so much money to buy the services, but does it mean that those services are of quality? And with a tight manpower in the homes, I don't see why so many private homes can take care in the healthcare voucher scheme and provide daycare services or home services for the families. I think the government is only spending more money to help private homes make more profits, reducing the waiting queue for residential care homes, but without actually enhancing the quality of support and service for the elderly people. So the problem that needs to be resolved is that you should have proper planning for subvented homes. Thank you. Next one. Mr. Chen Ching-fan. Yes, we are from the labor union in the residential care home sector. We have noticed that we need more manpower because of the deteriorating health of residents. In 2007, we proposed to the then Social Welfare Department Chief about the need for manpower, and only a decade later did the government address the problem. So the quality of private residential care homes is really caused by the government's negligence over the years. And in the government's report of the 29,000 applicants for elderly care homes, more than 14,000 were then living in private homes. That is, residential care home residents indeed have no confidence in where they are staying, but the government is not determined to improve the quality there. On the contrary, it gives priority to privatizing the services. I think of many people who sit here, I think we find that very regretful. And you can also see that the government maintains the number of subvented places at 27,000 without addressing the huge demand for subvented beds or places among elderly people. So I think that shows the government has been really not doing much. And lately, when we look at the quality of some rehab homes, I found it very regretful. Today is more than 30 degrees, but a few days later it was much hotter. And I went to some rehab homes. I found that there were no air conditioning there. All the residents actually did not wear much, and they were just walking around in their home naked. So where is a dignified life? And you can see that the toilets, bathrooms have no privacy. There's only one curtain. That's it. That's all you can find in the toilet and bathroom. And also, some homes are using outdated foods or canned foods for meals for the residents. So how is the Social Welfare Department monitoring the quality of these homes? We do have much doubt. I do hope that the working group cannot wait for 2 years. It should actually, by phases, concentrate on reviewing certain aspects of the regulations instead of waiting till after 2 or 3 years before they act. Otherwise, in the coming 3 years, whether it's the elderly residents in the homes or the residents in the residential care homes for the disabled, they'll be living in hell. Thank you. Next one is Mr. Wong Chok-ki. Okay, thank you. We are celebrating the anniversary of the handover. It's been 20 years, but yet we are really upset. I'm full of hopes, however, here. I hope that I will not be sued for saying the wrong things to the extent of being broke. And I also like to congratulate Lord Chi Kwong for being appointed a senior official, and I hope that he can still retain some conscience. I hope he can remain conscientious. And thirdly, I hope that Mr. Lam Ching Choi and Mrs. Carrie Lam can listen to the views of the deputations today and seriously consider our proposals. Mr. Lam Ching Choi said that aging in place and having neighbors looking after one another is the goal. But they are not willing to have non-means test. So if you don't have non-means tested policy, then how can they be given the help? Because you do need to, for example, buy fruits to treat your neighbors who are looking after you. So, Chairman, you need to have the retirement protection to allow the elderly people to be able to age in place. Back to the topic of residential care homes, I think the government has a big responsibility here. I mean, police officers can have their covert officers, so you can really get undercovers into the homes. You find it very sad to see what happens there. Let me warn you. Last time we said this. Why don't you have euthanasia if you don't properly monitor the quality of lives in residential care homes? The elderly residents in the homes actually are trying to die. Well, some jump to the death. The cheap care homes, let me warn you, don't just listen to Matthew Zheng that they will take over them. They cannot take over the cheap ones, because if you take over them, many will die. You need to find a way to help the homes. Most of the residents there are on CSSA.
I don't know why it's coming from public office anyway. Why can't the government run the homes? If people are able to reap a big profit from running the home business, why can't the government do it? It's so incompetent. The government should consider building public care homes, or perhaps ask the FEHD or the etc. Well, ask those to help clean those homes as well. do something good, please. My time is up. Thank you, Mr. Wong. I also hope that your wish will come true. Next, Ms. Kwan Kit Man. 3 minutes. Good afternoon. I understand that for low-income earners or the CSSA recipients, they spend most of their savings on these private homes, and I heard from many friends that once you're there, you'll be trapped because of the very low staff inmate ratio. Nothing extra can be provided. And as you heard from different deputations just now, there may be inspections, but they don't seem to be effective on improving the situation. So there are people who have no alternative but to resort to private homes because they couldn't get a place of subvented home. But we have heard about a number of incidents that expose the problematic quality of private homes. So we should consider how a review can be conducted and how things can improve. Many suggestions were given just now. I hope they will be considered. That is to say, to have improvement in a holistic manner, so that we don't need to hear about the helpless situation inside in terms of the hygiene, the meals. Don't just tell us that nothing can be done, because at the moment there isn't even enough space. I hope that the RCH ordinance can be reviewed and the department can step up inspection. Because if there is a shortage of manpower for these homes, then they cannot do anything apart from meeting the basic needs. Thank you, Ms. Kwan Kit Man. Next, Mr. Lam Lai Sing. Thank you. Yesterday, we forwarded our written submission to the Joint Subcommittee, so I won't repeat it. I just want to point out that in terms of care home service, more manpower resources should be provided. The carers should be dedicated and they should have empathy. In the past, we had a spate of accidents or incidents which show that the home operators at the moment are unable to provide adequate services to the inmates, and there is also a systematic problem. I hope that the government would face up to the issue. We look for an overhaul of the system. We hope that the RCHD and RCHE ordinances can be reviewed in 2 years so that the licensing threshold can be raised. And in terms of the code of practice, in terms of social integration, recreational activities, and other facilities, I hope that more support can be given to improve the environment for the inmates. And also the inspection effort should be stepped up. The model should be changed so as to target the unscrupulous, non-compliant homes, and there should be penalty system. We have been advocating this for a long time. I don't know when such a system can be set up. And the subsidy amount for the homes should be increased so that they can employ more suitable full-time staff to alleviate the manpower shortage. And I think that's relevant to both private homes and subsidized homes. The government should also provide incentives to for the home operators to improve the pay and benefits of nursing staff so as to reduce turnover. So we need to deploy more resources. We need to provide more training to staff and improve their sense of recognition, and that accounts is based on improving the system, and there should also be something done to improve the image of nursing staff and home carers to attract young people to join the industry. And there should also be a reduction of the outsourcing mechanism so as to prevent using outsourcing of service to reduce the cost of running homes. I hope that within 2 years the government can come up with the RPP review system. And service users should be able to express their views. They should be engaged. In the past, they have not been able to participate in the process. Next, Mr. Ip Kay Chun. Like the bridge of rehabilitation incident involving a private home, the problem had to do with the people. Jiang Kim-hwa was the culprit. He was evil in operating the home, but then when the case was taken to the court, he just walked free. He was acquitted. 24 years ago, Jiang Kim-hwa was already fired because of something bad he did in a rehabilitation organization. But 2 decades on, he was able to switch to another organization and operate a home. The problem is the government. The government has not properly monitored the situation. This person should be banned from doing something such as this in society, but he was allowed to do so. So my first question is that Jiang Kim-hwa was sacked for having breached the regulation in the rehabilitation service unit, but he was able to operate the home eventually. Second question, why is it that he could walk free despite the fact that he indeed committed something very wrong? What is wrong with our society? Why can't we punish him? Third point, his incident shows or deals a great blow to the private homes in terms of the quality. And fourth point, can we engage the police in investigation, but can we improve the service quality? Because if something bad is going on inside, they would not be discovered. Fifth point, I think that the government should set up a committee on mentally handicapped persons, and the composition should comprise the government and the stakeholders so that we have comprehensive assessment and formulation of and implementation of policies. Point number 6, there should be comprehensive training for carers. There should be assessment on the performance of the homes territory-wide, and there should be an award, and we should take a carrot and stick approach. But the problem is the government is not doing that. Point number 7, qualified persons should be subject to assessment, and for private homes, they should not be run on a profit-making basis. The government should fully monitor their work. Thank you. Next, Ms. Lam Sin Man. Well, I think the government should do something about it. You have spent 3 years in the temporary licensing arrangement, for the homes not yet meeting your requirements, you have granted a 3-year temporary license to them. I want to know what actual assistance can be provided to these homes in the 3-year period. Or is it that these homes will be phased out after 3 years? Do you have the manpower, the resources to replace all these homes? What is your plan? In these 3 years, what actual support can you give to these private homes? If there is no support by then, are you going to revoke their licenses, or are you going to give them another 3 years? We really want to know the answer. Would you please respond to that? Also, for private homes, I don't think you should rely on the market, because this is about serving people. We're putting people first. It should not be commercialized. We're talking about feeding them and helping them answer nature's call, and you still need to ask them to wait for 3 years. Also, every year they claim that they are unable to recruit sufficient staff because there is no candidate for job interviews. These are obnoxious jobs. No young people will join the sector. Sometimes they can only recruit mainlanders speaking some unknown dialect. Even if they recruit staff from the mainland, they speak dialects that we're unable to understand or communicate with them. How can we tell them the needs of the elderly? I hope that the government can have sympathy on elderly people so that they can lead a dignified life. We don't want to see a repeat of these incidents in the news. The problem is the government. The government is too lax in monitoring the situation. We have the laws in place, but there is no enforcement. There should be a penalty system by way of fine or imprisonment. You should give some deterrence. Don't just pay lip service so that people will ignore you. The government should provide actual support to subsidize these homes, because they only charge several $1,000s per person, and yet they can make it so profitable as to operate a chain of homes. At the moment, nobody can reassure us that the elderly people can live a comfortable life there. They are very reluctant to the idea of a care home. And this also caused a deterioration of family relationships. The elderly people wouldn't want to go. We don't want to send the elderly people there. But does the government have a better home care service to help these families? Next, Ms. Ho Wai Ling. First of all, I think that in terms of the various services of private homes, the government has not stipulated specific requirements. As a result, the staff elderly ratio is so unreasonable that there is a severe shortage of staff, which may lead to elderly abuse. For example, I witnessed that myself because my cousin lived in an elderly home. When the elderly person is fed, before the first spoon is swallowed, the carer fed her again and then again. The elderly person was unable to say no. She just nodded. She just shook her head, and then the carer would think that the elderly person wouldn't eat and then would just take the food away. That's why my cousin always complains about hunger. And also for diapers, they would be left there for a long time before it is changed, once several hours. And the excrement, would cause the flesh of the elderly to rot, and the carers don't help the elderly people to turn their body so that they get abscesses. And the room is so small. When one gets into a room, immediately you step onto the bed, and then there is just a small fan. There is no window. The air ventilation is very poor. The hygiene is very poor. You can smell the stench when you walk in, and this has to do with staff shortage. The solution to the problem is that, first of all, the government should formulate new policies and requirements on these care homes. Let's forget the past, but you should set new requirements. You should monitor and manage it properly, and you should also step up inspection. You must not allow the private homes to ill-treat the elderly inmates so as to make more profit. Secondly, you should shorten the waiting time for RCHE. Some elderly people pass away whilst waiting for a home, waiting for a place, and this often happens. Thirdly, you should improve community care to address the imminent need. Thank you, Ms. Ho Wai Ling.
Next one, Elderly Rights League, Ms. Lau. I want to say that, the residential care homes for the elderly, there are not enough of them. And there's so many old people, and many are stuck in the queue for years. So I hope that the government can pay more attention to us, build more homes for the elderly. People like us. We are in such a sorry state. We worked for decades, working from 7 to 7 every day, working more than a dozen hours a day, and when we get old and we can't work, we've retired. We're old now, and our body becomes weak. There's little we can do, and yet we are stuck in the waiting line or the queue for the homes for years. And those who are living in the residential care home, the residents there, they're not given proper care. Sometimes you can see urine, actually, and people don't come to change their diapers frequently enough. And sometimes really the muscle on the body of the elderly residents have gone bad, and their body needs to be thoroughly cleaned after a long time of neglect. So residential care homes for the elderly actually are supposed to be the place for people who have worked hard for so many decades. So the government should show its conscience and should not make elderly people wait for so long to get a place. And you're saying that you don't have enough manpower, and but when a home knows that there is to be an inspection by an officer, then they will just call up other homes to get more staff to come over before the visit or inspection by the SWD. And during the inspection, the officers concerned will say, well, this home is not bad because there are so many staff there, and the residents should be properly cared for at the home. But after the inspection, the staff called in would leave as well, leaving just a few nurses looking after all the elderly residents. So sometimes, we have Filipino staff Filipino maids looking after the elderly people, and yet we can't communicate with them, and they don't properly feed the elderly residents. Sometimes the workers just leave the residents hungry, and sometimes the residents choke while eating. And when accidents happen, they call in the doctor, but sometimes the situation has become very serious. It's really key for homes to have more manpower, because elderly people's bodily functions are not working that well, so they have to eat and swallow very slowly and be properly cared for. Next one is Ms. Ho Yao Lin from Concerned Group for Long-Term Care. Good afternoon. For the residential care homes for the elderly people, I hope that you need to pay attention to the management. Why is it that some elderly people don't want to move into a home? Well, there is an elderly couple, both of them. The male can walk. The female find it difficult to walk. And she fell down after cooking, and since then she could not walk. So the couple end up actually being confined to their flat, and they died without anybody knowing. In the residential care home for the elderly, the nurses there are so cruel to the residents. I know someone in my estate whom I visited, and whenever I visited her, she cried to me. I cried because of that as well, together with her. They gave her oatmeal, and yet all the oatmeal spilled over her body. So it's like actually getting, rubbish onto her body, and she couldn't do anything. So she was not properly fed. So you really need to pay more attention to the quality of the homes. Don't you feel sad hearing this case if you treat your parents like that? If you treat them the way that the elderly residents are treated in the homes, not properly fed and not sleeping well, and residents with diapers and not properly looked after. I hope that senior officials like you should monitor closely to see. Really, you need to inspect from time to time, particularly when they are maybe during the time when the elderly residents are being fed and when they're taking baths, to see how they're treated. Actually, many of the carers who are from the mainland, I saw some of them hit the residents, and I said to them, well, people pay the home to get you to look after them. You shouldn't treat them harshly. And then the carer talked back to me saying that it's not my business. But imagine their own parents being treated that way, hit by a worker. You wouldn't allow that, right? So I think you really need to pay attention. Really, you need to monitor the quality of private homes. They can't move into government homes, and the children have to work. If they are just staying in their homes, they are in a pitiful state as well. And yet they can't get a place in a government home, and they're forced to go to a private home, and the work attitude there is so bad. How can the children work, without worries if the children are in such hands? So please monitor these homes more. Thank you. I do hope that the officials today can take on board, the deputations' views and all the complaints about the various cases. After the meeting, you're welcome to get the officials to follow up on the complaints and tell them which homes, that you were talking about. Next one, so-called Ng Wai Tong. Well, someone just proposed that we should send undercovers into the homes, but I think if you want to send or get undercovers, I'm very pleased to provide you with undercovers to monitor the quality of private homes. Okay, Chairman, can you ask the question for me, for the officials? In May 2015, when the the scandal of breach of rehab residential care home happened, when the elderly people are being bathed in the open, I remember the SWT promised to review the residential care homes ordinance. But now it's been 2 years. Even today, in today's paper, we see that in June 2017, this month, the government has set up a working group to carry out the review. But what is your timetable for the review of the ordinance? 2 years ago, the review was promised. And only this year did you set up the working group. The pace is too slow. I don't know what, the children of those affected elderly residents would say. They would have called you, asking you, why have you not done any review till now? So today's topic is on the quality of private residential care homes, but there are 7 proposals by the government. 1 to 4 covers inspection, dealing with complaints, stepping up monitoring and enforcement, and so forth. So the government is assuming that the quality of private homes is bad, therefore you need to tighten up your monitoring and inspection. But the topic today on the quality, or how to improve quality of private homes. So review is important. That is, it relates to the work of the working group. The same director, Ms. Ian Man-Kun, I don't know why she wasn't promoted. Maybe this is the reason. You promised review, but how come nothing is done until now? The government said that over the past 2 years, because they were doing the consultation on the ESPP. I know you need a review, but the review was promised 2 years ago, so how come you haven't started the review of the legislation yet? So we have heard many deputations talking about the need to improve manpower. But if you don't improve or amend the legislation, then it really cannot address the real issue. And you talk about training courses. Well, training courses can help increase manpower. Just then, some other deputations said that, elderly services are not attractive to people. So how can you draw people into the profession? I think you need to change legislation first, and secondly, you need to improve the wages to ensure a certain level of wage. The same suggestion was made earlier, but the government's paper has no mention of how you can improve manpower to improve the quality. I wouldn't blame the quality or the private homes themselves, because the legislation itself is flawed. You have 1 staff taking care of 40 residents, which is allowed now. But how can you have 1 person changing the diapers of 20 people in an hour? If you have kept changing diapers yourself, what would your attitude be like? So if you want to improve quality, you need to tell us. But you haven't told us when the staff ratio can be improved. When can you achieve that? For the children whose parents were bathed openly, you haven't given them an answer. When the situation will be corrected. Can you demonstrate before us how to change diapers? But the problem is inadequate manpower, and you're not going to ensure certain wage levels. So when can you let that happen? Thank you, Ng Wai Dong. Well, I will definitely chase the officials later on. Next one is concern group for the rights of the mentally ill. Just then, someone said that, mentioned about the healthcare voucher. If you use the principle of money following the person, then they said that that means the elderly people would be forced to live in hell. But I can't see what the rationale is. Even if you step up inspections, all along SDP has stepped up their inspection. For the vulnerable, say elderly people or the disabled, we need to shoulder commitment for them. And just as someone said that care homes for the elderly all along have not got enough places. Same for the homes for the disabled. For the mental patients, residential care services for them all through the years have not been increased. Just 1,500 halfway places. Long-term care homes is only about 1,500 places. An additional 80 places were added in recent years. That's it. But for the number of ex-patients, it has been on the increase. 20% increase over the past 5 years. At the community level, there are just about 30,000 follow-up cases. So for those who need residential service, what can they do? Where can they go? So, because no matter what the quality of service is, they would have to go to the home. They haven't got any choice, so that they can be looked after all.
But the quality of these homes are very poor. So we hope the government should bear in mind how many users need the service. The report just mentioned did not address this issue. We hope that the RPP can address this issue. And on the RCHD ordinance, it was commissioned in 2011, and exemption is now given for 3 years and then another 3 years. And like the other deputations said, if they are still not up to standard, will the government grant another 3-year exemption? We have discussed many times. According to the government papers, we should allow time for the private homes not yet up to standard to improve. But what about giving time for the disabled to improve their living environment reasonably and also to lead a dignified life? That there is no such mentioning in the administration's paper. Please consider our perspective as users, not just the perspective of home operators, to give them reasonable time. And in the paper, it is said that you will put in place a professional to be the person in charge, and I hope that this will be implemented as soon as possible. Don't wait for another 2 years, because one professional isn't really enough. We need more supporting professionals. Next, Mr. Lee Chi-yong, Association of Parents of Severely Mentally Handicapped Persons. Because of lack of community support, some disabled users and elderly people are forced to live in private homes. Because the quality of private homes vary, the government then put in place the ordinance to regulate the homes. But the ordinances are so outdated that they have become toothless. One example is the staff ratio. At the moment, the ratio can only sustain basic operation, and it cannot provide adequate care. And there is no therapist to take care of the sensory and other therapies and other psychological needs. Can we just feed the users, and is that called living? And if there is already a manpower projection report prepared for our reference, we request that this establishment projection be incorporated into the law so as to implement the minimum staff requirement. Apart from staff ratio, there is also a problem with private homes. Well, we have the SQG program introduced by the Social Welfare Department so that different stakeholders can call for surprise visits in their homes to give advice. 2 members of the SGC already completed 2 home visits, and it's on a voluntary basis. They have not raised many questions on their facilities and the quality of service and the safety, etc. After striving for improvement for many years, the government is now moving towards improvement. But it is estimated that 2 years will be needed for review, and we're disappointed. Our organization suggests that all homes should be subject to the group's visits, and the government should consider the group's recommendation. In 1 year's time, the review should be completed, and in 2 years' time, the law should be amended. The staff ratio should meet the minimum staff requirement projected by the department, and the living space should be up to the standard for public housing. And for private homes, they should not, for the disabled, no children under the age of 18 should be admitted, and something should be done to safeguard the safety and health of the inmates. Next, Ms. Mak Yun Lin from the Concern Group on the Livelihood of Elderly People in Tseung Kwan O. I have 2 points to make. First, the public has the right to know. After the Cambridge nursing home incident and the Bridge of Rehabilitation incident, we are concerned about care for the elderly and the disabled. During the consultation period for the RPP, we on many occasions urged the government to set up a monitoring committee or supervising committee comprising members from the government, parents, and the public, and other stakeholders. The government incorporated our views and set up a quality surveillance group with home visits. Unfortunately, this has not been widely publicized. The majority of the public had no idea the existence of this group. When was it set up? Who could join? Was there any time limit? We knew nothing about it. I believe that the public has the right to know. Second point, the public should be able to monitor the government. According to government figures, as of the end of September 2016, RCHGs under the RCHG ordinance amounted to 732, and there were 310 homes for the disabled under the RCHG ordinance. Altogether, there were 1,042 homes. Now, I talked about the service quality group comprising representatives from the government, councillors, parents, and the public. We should be able to monitor the performance of these homes, but only 231 out of the 1,042 homes were subject to our inspection, and also 49 homes as little as 49 homes could allow inspection by the public. So it's less than one quarter, just 210 such homes. And for other homes, three-fourths of them which are reluctant to being inspected by the public, how can we monitor them? Why is it that they can shun the public radar? I think that the public should be able to monitor them. Thank you. Next, Ms. Yip So-yu. I just want to make a simple point. Well, we should do something to care for the elderly. And about recruiting staff, well, the staff should be recruited to take care of the elderly. Well, I was in Chunwan, the Cambridge nursing home, and then there was a man next to me being tied up. The man was tied up, and I asked why he should be tied up, and the staff replied that the man was naughty and he tried to go away. So I just asked the man to listen to the nurse, and then I would ask the nurse to untie him. And then I was the staff, I was on night shift, and then I asked the nurse to untie him, and then the man was happy. He smiled and said the nurse didn't tie him up. And then I told the man not to be naughty so that he wouldn't be tied up. And eventually he did escape, and he was nowhere to be found. And we called his home. And then he asked his home to get him some money. So that's about elderly home. Well, you should recruit somebody who is dedicated to serving the elderly. Those living in an elderly home, they should not be bullied. They can voice their demand. So when you hire someone, you should make it clear to the candidate what is involved, how he should serve the elderly. If he is not up to the job, then don't hire him. When you hire somebody, if you don't tell them about that, then this doesn't work because everybody has sympathy. Just like children, they can be naughty, but their parents can teach them. Just like educating children, you need to educate them since young. So when it comes to recruiting staff, you need to tell them right away as a matter of education. Because once they get used to the environment, they won't be coached. Thank you. Thank you, Madam Yip. Next, Madam Zhang Yip. Thank you, Chairman. I want to talk about reviewing the homes and the code of practice and the work of the group. We have no idea about the issue. We were never invited. On the other hand, the bosses of private homes could join the group and attend meetings. And we're concerned. How can we make sure that the legislation enacted would protect us? Because you're only discussing with the boss of private homes. At the moment, one staff member takes care of 60 elderly people, and there is no improvement. The group has come up with recommendations on a legislative amendment and amendment to the Code of Practice, and it is estimated that 2 years will be necessary to review the Code of Practice. And that's just one single task. And this is just one step because you also need to consult the Labor and Welfare Bureau and the stakeholders. And we also need to draw up the details of the amended Code of Practice. So that's 2 years after 2 years. You need to go through such a long procedure. So when will it end? Well, our elderly people won't have time to wait for you. Dr. Lam Ching Choi, chair of the group, once said that elderly people living in homes with standard like the Cambridge nursing home would be rescued. But the voucher scheme does no help at all, and there have been delays in amending the law. So you should amend the legislation as soon as possible to save them. We think that the procedure should be completed in 2 years' time, along with the amendment to the legislation so as to help the elderly people. Thank you, Ma'am Zhang. You just now sang, but I think that you have correctly summarized the administration's work, and that's 2 years after 2 years. Ms. Lau from New People's Party. We think that the government should not only provide subsidy. The government should take the lead in order to provide comprehensive policy support to elderly homes to address the problem of staff shortage and to improve quality of RCGs. I want to talk about the use of innovation technology in advanced economies. In Asia, many advanced countries already understand that it is difficult to rely on increase in manpower to solve issues. Instead, they rely on innovation technology. And for example, in Japan, they use robotic arms to help elderly people lift things up, etc. And this improves the service quality. In Hong Kong, we also have a lot of young people in the I&T sector. They do research in the robotic arms and electric wheelchairs, and also robotic technology to identify medicine, and they can also help take blood pressure measurements from the elderly people. We can give this a thought I believe that the government, the community, the business sector should be more open-minded towards the use of INT and be more supportive so as to enhance the quality of elderly care. The other point I wish to make is about our CHE ordinance. In terms of implementation and enforcement, the ordinance is being criticized. I think that the government should step up its monitoring efforts. I once heard that a carer in our CHE told me that the home is so small, an elderly person can only move about from his bed to the dining room and the corridor. And even if an elderly person falls, the carer cannot take care of the elderly person at once. In terms of the spatial requirements, staff ratio, these requirements are already very outdated. I think the government should review the ordinance as soon as possible to improve the service quality of homes. I'd also like to talk about long-term development. I heard about an elderly lady living in Taikoo. She was arranged to be sent to a home in Fanling. And when she was admitted, she told me that it was like living in prison, because she originally lived with her family, but then her children had to work and her grandchildren had to go to school. They traveled a long journey to Fanling to visit her. She herself didn't know how to go to that home, and the environment was so unfamiliar to her. If the elderly person can age in the community with adequate support from the neighborhood and mutual support from its neighbors, it would be more desirable. And I think this is the way forward in the long term for improving the elderly care services.
Next one. Good afternoon. I've worked at 3 residential care homes for the elderly, both private and public. I found the great difference between them. For public homes, in terms of environment, fees, it's much better than the privately run homes. And of the 3 homes, I also discovered the same problem. That is, when the SWD comes for inspection, the person in charge would ask us to try to write down all the tasks that we've done and to arrange for the carers, for the elderly residents to do their work properly, for example, feeding. And also when we give the residents drugs, they tell us to do it carefully. So I personally, as a carer, when I saw what happened, I felt bad. And some homes, say for the ones that I worked in, on the surface they look clean, but actually the environment wasn't good at all. It's really bad. And at one of the homes, the residents were infected with infectious diseases, and because they didn't want to let the SWD know and to avoid trouble, they were asked staff like us to arrange for the infected residents to the person themselves to go to an isolated room, and did nothing to look after her. So I was really sad to see that. And there was also an elderly resident who told me, telling me that it's so hot that at night she couldn't sleep. What could she do? She said she almost died from heat. I don't know what I can do to help her. I very much want to report about the mismanagement at the home, but I don't know what to do, because once I made a report about the home, I don't know where the elderly residents could go. So all these experiences actually made me over the past few years dare not develop my career further in the field. So I hope that the government can step up its monitoring of the homes to protect the residents from further abuses. Thank you, Ms. Ng. Thank you for your brave account of what happened. We do really know people who know what happened to tell us the details. And next one, Koi Chung Estate Elderly Rights Concern Group, Ms. So. We think that the future development of homes in Hong Kong must be one of improvement, and there should be more subventions. If the elderly residents need to move into a home, that could be the start of a painful period in life. They could choose to wait for subvented homes for an indefinite amount of time, or they go to private homes. The richer families know what to do, but for the grassroots families, if they were to live in a private homes, there will be three consequences. One is that their savings will be dried up, even if the elderly person is living in a cheap home. And secondly, it will increase the family's burden. The family members will need to pay more to withstand the pressure of private homes, or let the elderly person stay at home until an accident happens. We want to address the issue of the home issue. Therefore, there's this thing as residential care voucher. But is the voucher really useful? Well, we've got so many deputations here today. I'd like to know, so far, how many vouchers have been issued? How many have been used? And how many beds have the voucher provided for eligible elderly people? There's a saying that the vouchers themselves, the utilization rate is not high because private homes have not joined the scheme. So I think you would like private homes to join the voucher scheme, right? But as we just heard, there are two main issues. One is the quality of private homes. There's so many examples to prove that residents living in the private homes have actually entered into a painful period in their lives. And some elderly residents, when they live in private home, they need to get their family member to sign a document saying that they will not claim for hold anyone accountable if their family member, the resident, falls at the home, or they might be asked to pay to tie their elderly family member up at the home. So can private homes be really a solution? And secondly, monetary concerns. The maximum subsidy is $12,090 for a voucher. But will all residential homes notify their fees? You can see that there are various costs for various kinds of beds. For a weak, frail resident, besides renting a bed space, they may also need an electronic mattress, and they may need to buy milk powder and so forth, and they may need to also rent a vehicle and also a person accompanying them to go to the hospital. So for grassroots families, wouldn't the voucher actually add to the financial pressure of the families? So I hope that the private homes would have enhanced quality, and there can be improved services at the residential care homes instead of relying on the private market alone. Next one is the Labour Party's Kwok Wing Kin. 2 years ago, the Bridge of Rehab residential care home in Tai Po was where the scandal of elderly residents being bathed openly happened, and the Cambridge home last year uncovered more problems at the residential care home. So the society cannot bear with any more abuse of elderly. So the quality of private care homes is an issue, and it's because the government reduced resources and it used the rely on the current residential care home ordinance to deal with the issue. But the Audit Commission report showed that for those applicants who are on the list waiting to improve the quality fell from 7% to 5%. And the waiting time for improved bed places actually was 7 months. And so it reflects that even if a home has bought places, their quality is not guaranteed. It could be even worse than private homes, some private homes. So therefore, the public would not welcome such homes. The chief executive-elect Carrie Lam said in her manifesto that she will continue to promote the residential care service voucher scheme to abide by the principle of money follows the users, to enhance quality at residential care homes, and also to provide more support for that. But is that achievable? The Labour Party feels that such kind of thinking is really not going anywhere, because for homes that want to maximize their profits, the benefit and rights of the users are secondary. People running to private homes are not considering how to provide good services to the disabled or the elderly people. What you've seen is that for the residential care service voucher has the same value as the monthly value of the EA place in the market. But the staff establishment in EA1 homes actually can be a model, but the EA1 home, as you all know, the quality of service isn't that good. The so-called minimum standard is really just the standard for enhanced service. So is that something good? Is that a good model at all? We think that we are just trying to outsourcing public responsibility to the private market and shirking the government's responsibility to increase resources for the residential care homes. And lastly, for legislative amendment, there is a review working group that's been set up that will review the residential care homes ordinance for both the elderly people and the disabled. But their discussion scope and also their following works will take 2 years. Then there will be the consultation, law drafting, and scrutiny by electrical. How much more time would it need? And this will only cause the disabled and the elderly people suffer from the poor service of the homes, and there may not be any improvement in those the service of those homes. The Labour Party thinks that the legislative amendment should be finished in 2 years, improving on the staff resident ratio, and also to improve the environment and facilities there. Thank you. Next one. Today, we are talking about the quality and service at private residential care homes. But let us make it clear. Are we talking about what type of service we are talking about? Are we talking about the service for the rich or just service for the grassroots and the normal standard provided by homes for the disabled? There are two different markets. A market is not everything. Once the government has brought in competition to private homes, do you know how many operators are actually offering services to the grassroots and the disabled? And once the government has brought in market competition, we have seen competition not among operators to improve services, but among parents and the disabled to compete for places where they need to bear with inhumane treatment and their own dignity, even to the extent of being bullied silently. And even they know that the quality isn't good, they have no choice but to put their parents or children in the homes because they haven't got any choice. The government originally planned to rely on market force to replace its role so as to enhance the quality of service. But on the contrary, even the substandard homes are actually of worsening service. So we've seen scandals at the Cambridge homes and the breach of rehab residential care homes. It's because the operators know there's a huge market there. They have actually an endless supply of residents. So as a user, do I need to wait for a few years to carry out your inspections before I would know how bad the quality is? I've known for long how bad the quality is. The government is still using a traditional mode dating back to the 60s, 70s, putting all the resources and manpower in residential care homes, thinking that all of us would accept the services provided by the homes. But indeed, we have friends who need long-term care and residential care, which may not be in the form of a care home. Increasing places doesn't mean that you're providing increased service. How about manpower? You need to provide matching manpower. If you put more people in your homes without adequate manpower, you're just further worsening the imbalance in the market, because it's just the same number of people running the services, and yet people's dignity and rights and of the disabled are being ignored. And this is actually a breach of the International Convention on the Rights of the Disabled as well. So the government should amend the law in the light of the International Convention, provide more support for the disabled, and also provide policies that are rights-centered and encourage the participation of more community resources. You need to invoke Article 12, 14, 17, etc., 19 to improve on the policies. Thank you.
Thank you. Next, Ms. Ao Yim Fong. Thank you. How do we monitor the quality of private homes, be it subvented homes or private homes? They should, I don't know that they should provide up to standard quality service in order to meet the requirements. When it comes to lodging complaints, if a parent lodges a complaint, the parent would be blacklisted or would be considered as troublesome, and the parent would be asked to take the child to another home. Well, the government is lax in terms of enforcement and inspection. Retired police officers should be engaged, and there should be more manpower allocated to social welfare department. But what should they look into? How about the method of inspection? How should the matter be followed up on? There should be transparency for parents' information. We visited somebody with Parkinson's disease and with mental handicapped in the age of 50s, and the sister was asked to send him to a home, and fortunately the sister did not send him to a home. They only ordered meal delivery service so that he could continue to live in his own home alone. I know another parent who's in her 80s, and she has a daughter in the 50s with Down syndrome, and they're still living together with no mobility issue. Since the age of 2, she has been teaching the child to do household chores, and when the parent reached 79 years old, she asked the daughter whether she would live in a home. She's been living in a home for 6 years now, but they both believe that with community support, she should be allowed to live in the home. I also know another person with moderate mental, who is moderately mentally handicapped, and she was sent to a home and without any choice. And the staff member only listened to the instruction of her sister. How can the views of the person with moderate mental incapacity be heard and be respected? Who can protect the rights of these people? That is why there should be a third party there should be an organization in charge of that. Because of lack of support, this friend of mine continued to struggle with a social worker. With adequate community support, this person doesn't need to live in a home. My daughter also lives in a self-financed home. If we want round-the-clock community support, if there is round-the-clock community support, she would very much like to live with us, to enjoy family life without wasting government resources. Finally, care homes may be useful for some people, but we need to reform the system, and we should also adopt a different mindset and comply with the UN Convention on the Rights of People with Disabilities. Next, Ms. Tam Kar Men. We need to take part in the monitoring and inspection of subvented homes and private homes. For people with mental incapacity, we want to know whether training is provided for those conducting inspection. If there is training, what is it about? The training must adopt the perspective of a UN Convention on the Rights of People with Disabilities, and also the Code of Practice. And also, how do we follow up on the result of inspection? We should make the progress of improvement measures transparent for the benefit of service users and parents. There should be the information should be open and transparent. In terms of the service criteria and other standards applicable, there should be pictorial description as well as paragraphs of text so as to protect us. Parents, professionals, counselors, government officials. I have mental incapacity, but I have not committed a crime. Why are you sending us to home? Like a felon. We face life imprisonment, and we're deprived of our adult identity. We're not, we have no dignity. Does it mean that mental incapacity is a crime? Thank you, Ms. Tam. Mental incapacity, of course, is not a crime. We are not sentencing you to home. I hope that the government officials also hear you. Next, Ms. Fong Mai-Ying. In 1977, the first white paper on rehabilitation policy was introduced to help the disabled go through rehabilitation. In 1995, a new policy was introduced, scaling new heights, so to speak. But what does it entail? We're going to prepare the new RPP soon. But according to the UN Convention, rehabilitation is just one area of the policy for the disabled. So I think that first of all we need to come up with a new title. And that's the first point. Second point, when it comes to inspection or consider the service quality, we should not just confine ourselves to private homes or subsidized homes. We should consider the criteria to be adopted. Of course, the existing laws should be the basis, but the laws are outdated, and even if they are updated in the next 2 years, what criteria should we follow now? In 2012, we already become a signatory following China as a party to the UN Convention. So we should draw reference from the UN Convention on the Rights of People with Disabilities as mentioned by other deputations. Article 19 refers to living in the community. We understand around the world that there are homes needed by some. They come in different forms and scale, but if we read Article 19 of the Convention and also the submission, General Comment Report number 5, it is said that in a transitional period, as to how we can monitor and encourage existing homes to improve themselves and enhance their quality, there is a lot of useful information for reference, but at the same time we should refer to Article 14 of the Convention, so that service users, including myself in the future, will not be deprived of their freedom, and they can also lead a life with dignity. This is because if we live in a home, indeed, this is money following the person, because our financial autonomy would be given over to the parents. And then we are unable to make decisions. We have no right to information, no right to know. All information comes from others. So we should not leave our users out in our system. And also, accommodation doesn't mean residential care home. Long-term care doesn't mean residential care home only. We should strike a balance so that everybody will be happier. I'm sitting here, but in the future I may need to be sent to a home. I may need to use the facility. So I'm speaking for myself. In a decade's time, I may need to live in a home. Next, Ms. He Boyin. After the Cambridge nursing home incident and the breach of rehabilitation incident, there has been a public outcry. The Social Welfare Department should be responsible for monitoring the homes. To give the public greater protection, you need to amend the two ordinances to enhance service quality, and you should not relax your effort. Last night I read your papers, and I'd like to respond to your papers. Paragraph 6 mentioned that you're going to amend the two pieces of legislation, but there is no timetable given. We are anxious. It's been 2012 since it was enacted, and 6 persons with disabilities died in the 2 years' time, and you should not relax your effort. So there should be a timetable for reviewing the legislation. Item number 9, work progress. You said that you actively consider so-and-so to the newly recruited. I don't think this would suffice, because you have the power to speak for the underprivileged. You should not just ask them to actively consider introducing or applying the sexual conviction record check scheme. You should make it a mandatory requirement to refer to the record when recruiting new staff. And also item 12, we hope that for RCCs and RCHDs with warnings, they should be uploaded on the website for public inspection. And also about the service quality group, you should under point 14, you should extend it to all residential care homes across the territory, not just those who are willing to participate in the pilot scheme. You should not be so polite, because you have the power to conduct inspection on all homes. Point 16. You said that you provide support for those in need. Not only providing needy residents with casework support, but to provide support for every resident, whether or not they are in need or not. There should be a caseworker. You should not let them approach you. You should take the initiative to provide support for everybody in need. And also, I'm against the idea of admitting children under the age of 18 into private homes. And also about boarding places in schools. More boarding places should be provided in special schools so that they don't need to live in a home.
Ms. Leung from HK's CSS. On the monitoring of the homes through the two ordinances, the SWT is monitoring them, but the two ordinances concerned fail in providing adequate protection for elderly residents. Even though a working group was set up in June to review the law, the relevant work is expected to take 3 years. We hope that the Social Welfare Department can expedite its work, or to implement proposals by phases which improve the quality of the homes. Hong Kong Council Social Service urges the government to take note of the following proposals. Firstly, you should try to amend the 2 ordinances and enhance the requirements for issuing licenses, including per capita space and number of social workers and care workers and so forth. And you should also bring in the requirement for continuing education and continuation of being licensed. And the qualifications and training of persons in charge should be clearly and strictly stipulated. And to enhance transparency and to be accountable for the public and give the public more choices, HKCSS thinks that the WD should reveal to the public all the results of its inspection and also any reports about what they found about the homes. And thirdly, for subventing homes, there's such a shortage of them, so often the elderly people and disabled have no choice but to move into private homes. The government is obliged to protect these people and ensure that they get appropriate services. For all the elderly residents in private homes and the disabled in the homes should be given a caseworker, and that they can be their needs and their condition can be closely monitored. And for the 5 services regulations and other regulations which exempt homes from getting licenses, the government should expedite its approval process and to collect expert advice to ensure that these homes can meet the condition for being licensed in 3 years. And the SWD should review its code of practice and to lay down a feasible timetable for legislative amendment and to bring in the effectiveness indicators to ensure quality service and also rights of residents are protected. Next one is Mr. Chen Kaki from Christian Social Workers. Thank you. We've heard from a lot of deputations on the law and the cases. Just some supplementary information here. When we look at report number 62, which was released earlier, but it was released in 2014, and its topic is on the care for the chronically ill and the disabled. By 2014, back then, there was 137,000 chronically ill people. Among them, there are various types of patients, but today let us focus on the issue of homes. Among them, 5.2% were living in homes. So back then, that is about 71,500 people living in the homes, who are living in survivor homes, rehab centers, or private residential care homes. There should be more now, actually. And a recent data, that is by the end of 2016, the SWD did its own statistics, which found that the number of homes for the disabled, number 8,093, it increased by 181 compared to a few years ago. That is, in 2014 to 16, there is an increase of 2.24% in the number of cases. So I hope that SWD could also give us additional data on, that is, from 2014 to 2016. How about the number of bad places in homes? Has they caught up with the number of new cases? If not, then today's topic is even more important, that is the quality of residential care homes and their services. For private homes, because I'm a social worker, I once led some young people on visits to the homes, and as mentioned by some old women today, I heard and saw them myself. I can smell the stink, the stench, and the living environment there, and also the chronically ill and sick elderly patients who are not really properly looked after. There are actually elderly people who could not turn their body, and I saw a carer who even the person kept calling her for help, because I would just help him to get the carer to come along, but it took 30 minutes for an elderly person to complain of pain for 30 minutes and wanted someone to help him turn the body, and the carer didn't arrive till 30 minutes later. You can imagine the plight. And also, For Savannah homes, let me tell you a case. When I was leading some students on internship to a home starting with the letter P in its name, it's a big chain. Well, I think there's a problem with the staff training. I went there with 2 young interns. Sometimes young people are more passionate and they may have their own interpretation of what they saw. They may overinterpret it, but I heard about this incident from 2 interns. The home with the letter P in the name. That is a senior nurse at the home who talked to the carers there, telling the carers that, when you meet with the family members of the residents, just smile to them. I found what they said very scary. 2 of my students said the same thing to me because they heard it on site. They said the trainer told the nurses and the carers, empathy, love, they're useless, they're rubbish. So I challenge and I wonder, this big residential care home chain, what kind of service are they providing for the elderly residents? And because this large chain, on the ground floor of the home, there's a daycare center. And next at my church, half of it requires the service of this daycare center. And I heard from a wife that of someone who go to the center, saying that he would have been ignored and only given water and some food to eat if I had not, accompanied him. There were little activities arranged for the husband. So what kind of service is it, that's provided at a daycare center? For private homes, actually, one thing has happened. Because, Hong Kong has got a private home that's been listed. So it has actually its own management company. I believe that there needs to be monitoring of this company because when it actually raised capital in the market, people will pay attention to its service quality. I think in the years ahead, there might be more companies providing residential care homes and services for the elderly being listed. So if they are on the market raising capital, then attention should be paid to their really quality of service. Thank you. Next one is the Lee Chi-on. I come from a self-help group comprised of mental patients. I found that there's such a long queue for places in Savannah homes. Because of that, the mentally handicapped have to go to private homes. The environment at those homes, however, is not good, and there's little per capita space, and nobody care about their daily needs. For example, nobody arrange for sports activities for them, and even when where their money actually, has all gone to the rents at the home, and these residents are left with like tens or hundreds of dollars to use a month. And for these residents, they want a dignified life, but we haven't seen the building of any public homes for a long time. If you're lucky, you can get a place in the public home after a few years, but if you're not lucky, you will never be able to go there. So SWD, do you know, I don't know whether you know, about the long queue, excessively long queue for places in the home. So when we will see more public homes being built? I haven't seen anyone being built for a long time. So I'd like you to tell us, when shall we see more public homes? Don't mention to me the one in Siu Lam, because that's so remote. How can you expect people to move to such a remote location? I just want you to answer my question on when will there be public residential care homes. Well, later on, Mr. Lee, I will ask the SWD for you later on. Any other points? Okay, thank you. Next one, Mr. Yuan Kakao. Good evening. Private homes, all sorts of homes, the staff there should have the heart and ability and should have the dignity. That's very important. So the government or the SWD should provide more incentives and strategies to support the staff working there, train them up so that there will not be a high turnover. If they are passionate for the job, then they are really valuable assets. And for the private homes, even though they're in the private sector, their facilities, resources, equipment should actually be beefed up with the support of the government so that the quality of service can be enhanced. For service users like us and carers, we don't want to see the private homes being closed down. We don't want to make it difficult for these homes to survive. We want the government to have a systematic approach and strategy to manage these homes well, so that the quality can gradually and systematically be enhanced and be professionalized. For private homes, we should also give them the incentives, increase the incentives for them, so they can open more homes, increase the competition. With more competition, the quality will naturally go up. And then in the market, the homes themselves will have a level playing field, and hopefully the quality can be improved, and the users will get appropriate care. And within the homes, not just at the private homes, indeed, sub-venture homes, private homes, or daycare centers, and sheltered workshops, they have the same situation where the residents, because of the type of work they do or for the sake of management, these residents are gathered together rather than grouped together on the basis of their health conditions. Sometimes there should be different management for different types of residents. Some learners or residents are sick, and some have simple illnesses like cold, cough, but some may have undiagnosed problems, diseases. But the disease could be infectious. So therefore, you need to be careful with disease control. So therefore, there could be separate management and separation of residents with different conditions. So I hope that you can use your heart and devotion to look after them. Next one, Ms. Lee. Good evening. I'm a carer of an autistic child. I'd like to thank the SWD for letting us parents groups to take part in the working group on the residential care homes for the disabled group. I've been to various inspections, and do you think that there shouldn't be some training for people like us to help us how to inspect subvented and self-financed and private homes, and so that we know what are the differences instead of just expecting us to read papers? And the inspection schedules, I think, and the time involved are not adequate. At each home, we can only stay there for 1.5 hours, and then we will be rushed away. And we tended to focus on the checklist. So we are only looking at the hardware, and to put our assessment of the facilities, and also take off 5 lists for software, and make proposals as a result of our inspection. The inspection of the visit records itself are not complete. I hope that you can comprehensively rewrite or reform this inspection record. And for kitchens, nurses' ward, drug dispensary, or the rooms, the toilets, the beds. There's really much room for improvement in all these facilities, and the furniture use, the equipment, the cleanliness need to be further enhanced. Software, in terms of software, the staff ratio, the carers, qualifications, whether they're qualified, there's also room for improvement in their qualifications.
When recruiting frontline staff, you should recruit someone with experience to protect users. As for members participating in the inspection, the time limit is not appropriate because the time of inspection is not included in the inspection of homes. We find this unfortunate because we cannot communicate with we cannot talk to the residents. We don't know whether they are encountering any problems, whether they have any problems with meals and with the health. As a result, we could not properly monitor the homes, and this should be improved. As to whether the homes have a system in which the review will be conducted twice a year for parents' reference. We don't know. And also, at the moment in the homes, there is no partition, no curtains between beds, and if a resident wants to do something private on their bed, they cannot do that. There is no privacy, no dignity. Are we protecting the elderly and the mentally handicapped? There is no privacy, no dignity, as they are constantly under supervision. So how would we send our children to the homes? There should be more homes open to inspection by parents so that we can monitor the service quality. I hope that things can improve. Thank you. Thank you, Member Lee Chang-pui. I'd like the administration to respond to the deputations' views first. Many of them spoke on the setting up of the SQG, and the legislation will also be reviewed, but then progress is very slow. It takes 2 years for the group to discuss the proposal. It's been 2 years since the Cambridge nursing home incident happened. Just now, Member Lee and some other deputations talked about the SQG, about visits by the public. There is a lack of transparency, and many people are unaware of the group and they don't know how they can participate in it. And a number of deputations expressed concern about the pilot scheme on residential care vouchers. Of course, there is support, but at the same time, they also suggest that the money follow the user principle is not feasible, because instead of improving service quality, the money would at the end of the day go to the pocket of bosses. There's a lack of supervision in this regard, and also Mr. Lee Chi-on asked about the Sovereignty homes in terms of its planning and future development. And there is also another comment on transparency and people's right to know. For example, warnings, advice, when will it be made transparent, and whether you can make the inspection results transparent as soon as possible. There are also certain comments on case management. For example, whether the elderly or the disabled would be able to get the service needed, and also whether we can enhance the support for private homes. So in relation to these matters, would the administration respond to these views? Ms. Zhang from Labour and Welfare Bureau. Well, let me give you a brief response, and then I will refer to the Social Welfare Department to respond to that. I want to stress that the government attaches great importance to the quality of private residential care home. That's why in June the group was set up and a meeting has been held. That is to say, we have initiated the review of legislation on a number of areas. For example, staff ratio as well as per capita living space. Adaptation just now mentioned that technology should be used in care homes. The Social Welfare Department has actually adopted technology in the subvented homes. For example, we have a number of facilities that homes may utilize the funding from the lotteries fund to procure. In the future, we'll continue to enhance our work in this regard. As for the service quality group, maybe I'll defer to the Social Welfare Department colleagues to supplement. Ms. Wong? Thank you, Chairman. About review of legislation and codes of practice, I thank the Chairman and Deputy Chair, because you're also members of the working group. Our group comprises different stakeholders, with the Director of Social Welfare as the Chairman, and we also have representatives from LegCo members, private sector operating RCHDs and RCHDs, and also NGOs, service users or carers, academics, members of the Elderly Commission and Rehabilitation Advisory Committee, as well as representatives from the Hong Kong Council of Social Service and the Labour and Welfare Bureau. So representatives from different sectors put their heads together to consider our work, and we plan to review a number of areas. For example, the qualifications of managers and carers and trainings, and also registration of carers, category of offences and penalties, categories of homes, staffing requirement, minimum per capita living space. These are areas that will be reviewed by the working group. The review covers a very wide scope, and we anticipate that in-depth discussions will be necessary. And in 2 years' time, we expect to prepare recommendations for Labour and Welfare Bureau's consideration. And after drawing up specific recommendations, we will consult the sector and relevant stakeholders. We attach importance to the views of different sectors. Following that, we will proceed with amendments to the legislation. As for the code of practice, when it can be implemented partially, when we can do something about the codes of practice or implement administrative measures, we will strive to expedite our work in this regard. I want to make it clear that we want to complete this task as soon as possible as well. And that's about the working group. Can I also say something about the service quality group? But I think the point is they're concerned about the long time frame. You haven't addressed that. I think that we can. I'll let you talk about the group first. About the SQG pilot scheme on service quality groups for RCHEs. Members comprise district personalities, healthcare personnel, and other professional service users, such as parents. And they also make very valuable suggestions on their facilities and services. Just now, some parents mentioned about the time period of home visits, the length of stay there, whether it's sufficient, and whether there's been ample chance for everybody to express their views. We'll go back and review the situation and see how we can improve it. About the home visits of SQG, I want to reiterate that we have not notified the homes in advance. And frankly, the SQG doesn't replace the work done by our inspectors. We have the licensing unit of RCHEs and RCHDs. We have inspectorate teams conducting surprise visits. So the SQG doesn't replace the work of the inspectors. We just want to have two kinds of visits in parallel so that we can adopt different angles, so that the public can participate in the process and give us views. Labour and Welfare Bureau, anything to add, Ms. Chair or Ms. Zhang? Thank you. We are providing more choices for the elderly under the voucher scheme. We have not taken any resources away from the conventional approach. Some deputations talked about case management for every resident and the right to know, from inspection to the visits of the SQG report, and also advice and warnings given after inspection. It should be made transparent as soon as possible. Any response? Thank you, Chairman. About enhancing enforcement and transparency, we have updated our criteria for issuing advice or warnings to RCHEs or RCHDs, and about opening or releasing the records of warning against RCHEs or RCHDs. We are committed to enhancing our transparency and to providing more information on our homes. In February 2017, the Social Welfare Department has set up a website on RCHEs which contain information on over 700 elderly homes. We have information on their staffing and design and other matters, whether the home is under our SQG scheme, and other information. The website comes with a searchable function. As for the RCHD, we have begun to prepare, or we're planning to set up a similar website for public inspection on the information of homes. So I want to say that we are also working on it. I'll open the floor for members to ask questions. if there are other views from deputations, I'll give some time towards the end for you to respond to that. Deputy Chair and Ms. Lau Siu-Lai, 5 minutes each. Thank you, Chairman, and I thank you for following up on the issues one by one. I have many questions as well, but I'd like to first of all follow up on Ms. Naisan's question. If you tell on them, you don't know where the elderly resident can live. So she works there. She understands the absurdity of the place, but then she also suggests that if she tells on the home, elderly residents have nowhere else to live. This is a fundamental question. Every time when we talk about issues, we think about the consequence. Where do we send the elderly residents? Will they become street sleepers?
So once you file a report, what will happen? What should we consider? And secondly, as for the standards for inspections of homes, in overseas, one standard and criterion is whether the resident has muscle or skin diseases. If the resident has skin diseases, then that shows that is a sign of neglect, because the carers have not turned the bodies of residents often enough. I remember I once asked officials in Hong Kong's homes whether there's any record for skin diseases or blisters on the body of residents. And thirdly, Mr. Chair, he talked about ESPP. Mr. Chair, you're responsible for ESPP. So many deputations today talked about the vouchers and problems with the residential care homes. I don't know. Can the ESPP possibly incorporate the views? I know you would say that you're always open to views, but today, after today's hearing, what action would you take? The fourth question is the inspection team. Well, I'm also a member of an inspection team. I've been to a home in Yau Ma Tei. After we fill in the form, why can't the form be put online? Say 3 of us in the team, we fill in the form and gave a mark and comments on the home. I wouldn't mind our inspection record be put online, and then the home concerned could be asked to give their response. So all the information could be put online. I don't know why we can't do that now. Lastly, amending the land lease. There are issues where in some buildings they change the land lease to convert some spaces into a residential care home for the elderly. How common is this? And are there any signs, whether there are any conglomerates or real estate companies who are more inclined towards converting, by changing the land lease to convert buildings into care homes? 5 questions. Ms. Wong first from the SWD, please. Yes, as for making a report about what happened at a home, I do hope that whether it's the residents or family members or even staff, we do hope that should there be any incident or complaints that we need to investigate, I do encourage you to call us or use various channels to let us know. For every case of complaint, whether it's anonymous or not, we will seriously deal with it. Now, I'm talking about the channel. Of course, I know I can call, but I'm talking about the dilemma. What should we consider? We need to step up regulation. Therefore, I do encourage you all, if you see some, bad situations, do let us know ASAP, and we would send our inspectors to, use strategic means to see what follow-up action we can take. If a home is found to have breached the regulations, we will consider what we can do. No, we're not asking about the method, but the dilemma, because people haven't got any choice. What if a home is closed down? So what will happen to the residents? What professional opinion would you give to the family members or the complainant? Assistant Director may not be able to answer because earlier on we made it clear we asked the SWT to amend the law, including giving the department the law to take over a home. If the department can have the statutory power to take over a home, then people who make a complaint would know that the residents would not need to be relocated even if they file a complaint, because then they would know that the residents would be able to remain. And then only when that is incorporated into the law can people be more willing to make complaints. So, Assistant Director, I hope that you can make such a big change. I don't expect you to make any promise today, but that's what we have been calling for. That's exactly, really is behind the dilemma we talk about. No matter how bad a service is, people dare not complain because of the lack of protection. Okay, sorry, you have 4 more questions that haven't been answered, but you have to wait. Now still live now. Thank you. Every time when we ask the Welfare and Labour Bureau or SWT, I don't know questions. I don't know whether I should hide my tears or anger. There is such a whole bunch of questions, but the problem is never do we ever get a satisfactory answer. Not to mention the planning standard, which is unreasonable. But I want to know, aging population is something that we can plan beforehand, and we do have planning standard for an aging population. So why is it that over the past years, continuously thousands of elderly people passed away, not be able to give them a place? How come our speed of building a residential care home for the elderly is so slow, always lagging behind the standard? Don't tell me it will take 10 years. Because if it takes 10 years, then you should have planned for it a decade ago. So why is the delay? What caused this low construction of building of residential care homes for the elderly? And we've seen the series of problems with private homes, and many of its residents are people on CSSA, and they're running the homes as a business, providing inferior service. If we don't build more subvented homes, there's no way we can replace the badly run private homes. Would you then consider raising the ratio of public to private homes instead of just leaving it to the market? You cannot look at the homes as a kind of business. We are talking about a social service, not a kind of business. Don't push the elderly people into hell. And you've said that there's inadequate manpower and the homes are faced with problems, but you can plan for manpower. We can catch up with the shortfall through planning. So why was there such an inadequate supply of manpower? Have you considered how to match the manpower supply with the need? You did the 2-year enrolled nurse training, but they're just enrolled nurses. They're not registered nurses. Often, the actual caring work, like, for example, injecting needles, cannot be done by the enrolled nurses. So have you considered how to enhance the ratio of nurses caring for elderly people? Now, the homes is asking for 1 to 60. That's very inhumane. Can you increase the ratio of nurse to resident? And also, for frontline staff, there are fewer and fewer doing that because they are so tired out and the wage is so low. So what can you do to help the subvented or private homes provide appropriate wages for their frontline staff and protection for them so that the homes can attract more people into the field? Only then can you address the issue of helping the elderly. I'm not talking about the issue of inspections anymore. There's just a host of problems out there. Okay, firstly, any negligence in the area of planning to the extent that now we're lagging behind? And secondly, would you increase the ratio of surventer homes? And thirdly, how to resolve the manpower shortage? Mr. Chair, on planning, our ESPP and the group concerned has noted that there wasn't any criterion based on population in doing the planning. So therefore, to 2030, and with the long-term need for care with the aging population, and looking to the future in terms of demand for services, we do hope that more... Sorry, Mr. Chair, Ms. Lai was asking you about the past, but you're talking about the future. You said you hope that the planning standard can catch on, but how come in the past more people died and yet the pace of building homes was so slower than the death rate? Was there any negligence? Well, I think we were limited by the actual land supply. We had to find the proper sites to build the facilities. We tried our best all along on different occasions and at committees. We reported to people or to officials and other parties the limitations in terms of the supply of GIC, site for housing. As they say, that means it's a land issue. Chairman, I really can't accept his answer. There are 4,000 odd vacant crown lands in the urban areas. There are also a number of vacant schools. It's just that you haven't used the land. It's not that Hong Kong is short of land. 4,000 odd hectares. Some may be too small, but you said that there could still be 2,000 odd hectares of land available. Don't tell me that there's not adequate government land. Why in the past you failed to catch up with the planning standard? Who is responsible for that? Please let me know. Mr. Chair, for former school sites in our plan, well, there are school sites like in Sai Kung, in Tai Po, or Tuen Mun. There were plans involving former school sites. That is the SWD. Well, members, you need to know that we need to see whether the site is appropriate. We need to see whether the conditions are correct or right. But I and my fellow colleagues would try harder to find the land. And back to the ESPP. Chairman, I think that all the answers are very empty, all about land supply, but that's not the issue here. I hope that the SWT can give me information in the past. How many times did you ask to build residential care homes for the elderly over the past decade? How many times did you ask the government to build the home and you got the answer from the government that there's no land? Please give us a paper to tell us in the past. How many years? The past decade. How many times you asked for land to build residential care home for the elderly and the disabled? And the department responsible for finding the site told you that no land was available. Can you give us such a record, Ms. Chung? Yeah, okay, no problem. Okay, thank you. Leung Kwok Hong, next. 5 minutes. Sorry, I need to extend this meeting by 15 minutes. Well, 20th anniversary of the handover and the Commission on the Elderly was established after 1997. The first chairman was Tam Yu Chung, and the committee has been running now for 20 years. Now is headed by Lam Jing Choi. Leung Sze Lai was asking, what is the Commission on Elderly doing? What does it do? Let me read to you its terms of reference. That is to formulate comprehensive elderly policy, including care for accommodation, economic protection, healthcare, psychological service, employment and recreational services for the elderly. And it will opinions to or advice to the government, and should also coordinate all sorts of services and planning work for the sector, and also to consider proposals to the government in the light of available resources.
And 3. In implementing various elderly policies and programs, the Commission will monitor its implementation and to urge the government meet the relevant objectives. He asked that, and I just read it out. Well, simply put, I've always been championing universal retirement protection. But when it comes to this point, there are 2 answers. Mr. Leung, we face the problem of aging population, and that the elderly people will represent a drop in productivity. They are the burden to society, and we therefore cannot have retirement protection in the long term. And that is why John Tsang set up the Future Fund, meaning that we save all the money, $200 billion, and the revenue from land sale for white elephant projects, and that is the so-called Future Fund. Apart from this reason, they also gave me another reason. Mr. Leung, you're so ignorant. Elderly people need not only retirement protection, but expenses on other expenses such as medical, etc. But my question is on insufficient care home places. And then they would tell me, Mr. Leung, that won't do. We can't have more care homes. We should have community care instead and aging in place. But the question is it that when we have insufficient home places, they can really age in place and receive community care? And then Ms. Lau Silai asked who should be responsible. You said no one should be responsible because the government is a rubbish. It's a circular argument. You have nothing but stopgap measures. But worse still, the government imposes the wrong stopgap measures that don't really address the issue. You point to one problem, they solve the problem. They solve the problem of something else. I don't want to ask about the figures. I just have this question. You have so many government officials here, and your head is Lo Chi-kwang, and we have not had this experience for a long time. He has waited long enough. Now he is secretary. When he joined the Legislative Council, his wish was to abolish functional constituencies. I don't know what his wish is to join this government. To abolish the lump sum grant system, to implement universal retirement protection, or to take a holistic approach in addressing the care home problem. I discussed with Dr. Fernando Cheung. You need to have an independent commission like ICAC to be commissioned by the chief executive to do away with all the hurdles. He can take this up. Instead of providing more care homes, you ask people to go to different care homes with subsidies. Well, you can't rely on the market. If the quality of private homes is so good, you won't need to rely on the government. I don't want to say more. Please, your bureau chief, Lo Chi-kwang, when he assumes office, come back and report to us. Don't just give empty talk. Even if he has a high IQ, he should have high EQ as well. He should have empathy. And Dr. Fernando Cheung, in the Ming Dynasty, there was this emperor who was fond of woodwork. But this is not what we're supposed to do. We should address the issues facing Hong Kong people. Don't just move the problem from one place to another. I think, I have nothing more to say. This is addressed to Lord Chi Kwong. It should be uploaded to Facebook. Lau Siu Lai has a follow-up question, and then I'll see if the deputations would like to respond to the comments as well. Each will be given 1 minute only. Dr. Lau Siu Lai. Just to very briefly add that I'm very unhappy with the administration's reply, because for Tung Chung New Town, which will come from a reclamation project, very often it's a dereliction of duty of the Social Welfare Department, well, not SWD, but Food and Health Bureau on this occasion, because the Planning Department has already reserved the site for the relevant facilities according to the Hong Kong PSG. But the Food and Health Bureau itself does not intend to build a hospital there. And I'd like to have information from the SWD over the past decade, how many occasions in which your application for home was rejected by the government, and also how many occasions in which land was reserved for your facilities, but that you did not build the facilities. I'm not holding anyone accountable in retrospect. I just want you to understand that you may be in a case of dereliction of duty, even in your own profession, and please do better in the future. I'd like to have two supplementary information. First, on the abscesses, and also on converting the buildings with revision of DMC into RCGs. Over the past 5 years, would the Labour and Welfare Bureau or the SWD be able to do that, to give us supplementary papers? Yes. Yes, we can provide the information after the meeting. Thank you. So please raise your hands again. Chang Chung Fat, Lei Chi Yong, and the three in front. For Tung Chung Reclamation Project, I want to remind you that they have not forgotten the yacht club, and they also proposing they are building other infrastructure projects, and for these projects they will never be short of land, because they can acquire land if need be, or resume land. Mr. Chang, I have this question for the SWD. What is your stance on the General Staff Union? Because just now you talked about the working group. Back in 2007, we already told Patrick Nip to review the legislation. Why aren't we represented in the working group? It's been 10 years. Why is it that in this review group we are not represented? I want to have a written reply from you, or that you can request that they allow a representative of the staff union. Mr. Lee, please switch on his mic. I have one question. Well, we talked about local opposition as the main reason for opposing the construction of residential care homes. But why is it that you allow the local community to object to the facilities? Because if they don't want the disabled or elderly people to be in their housing estate, they should be sued under the discrimination laws. I want to have information on those opposing the provision of these facilities, so that we can follow up on the matter under the UN Convention. Yes, maybe after the meeting, the administration can provide us with the supplementary information. Next, Ms. Fong. About the working group, you talked about participation from service users. First question, any participation from the mentally handicapped or those or with autism? Because parent is one thing, the actual people with mental mental incapacity is another thing. I don't think we should deny the importance of residential care homes in Hong Kong, but what is more important is to expand our service model. I have been in the sector for 37 years. If you're talking about one home housing everybody, it's extremely difficult. So we should look for different sites. At the same time, there should be a variety of community support. At different public hearings, I already mentioned that in Hong Kong, the population is aging. We can have a community support center downstairs, and as a resident living upstairs, I can be served instead of being moved to and sent to a certain home or old people village. And please also consider the UN Convention on People with Disabilities. Next. Thank you. 2 points. Well, I want to have supplementary information in writing, and I think that between the Labour and Welfare Bureau and the Development Bureau, throughout the years, the Development Bureau has acquired a lot of land for public housing or redevelopment of public housing estates. How many sites have been reserved for subvented homes, or if it's a private development, have you requested the developer to provide private homes on the GIC sites? Also, in terms of quality assurance, how do you follow up on the issue of quality of staff? Staff training, what kind of training, what's the interval of training? If they are not up to standard, how do the private homes deal with these staff members? Because after all, they are serving people. Thank you, Mr. Chan Kit. Next, Mr. Lee Cheong. We have over 300,000 mental patients in public hospitals. In the next 3 or 5 years, it could rise to 500 or 600,000. And we have yet to see new homes. I don't know how the government officials can respond to the rise in figures. It can go up to 500 or 600,000. Let me invite the administration to give a brief response, and then I will need to draw a close. As mentioned just now, for the membership of the working group, we have included carers. You mean users? Parents. Parents are present. No, they mean the actual mentally handicapped persons, those residents. On the other hand, for our proposed workflow, when there are recommendations to review the legislation or the code of practice, we'll forward the recommendation to Labour and Welfare Bureau for consideration. We'll also consult the stakeholders. We hope to collect views from different stakeholders, including self-help groups and parents. So that's what I wish to add. And staff union representative, when we consider the membership of the working group, we have considered representatives from all sectors concerned. So the membership of this working group has included the relevant sectors. As for the views of different organizations, when we consult the sector, they will be able to participate. Sorry, speaker's not coming through. We're very concerned about the policy. Do you suggest that we're not a stakeholder? Are you despising us or discriminating against us? Deputy Director. Thank you, Chairman. We attach importance to your views. be it views expressed at the meeting or views expressed in the past. We have been listening to you, and that is why we have come up with the enhancement improvement measures in the paper. That is a consolidation of your views. Deputy Director, we have different stakeholders here today, and some stakeholders are not represented at the meeting or working group, including the actual users, the staff union. They may be mental patients or mentally handicapped persons or frail elderly people. I think that their voice should also be heard at the working group. You can bring this view back. Perhaps today you cannot reply right away whether you can have new members. I think that you can discuss that at the working group, and I also hope that your department can allow representatives from all sectors to join. As for the consultation document and the reports, I hope to have a simplified version once your report is ready, so that the stakeholders and parents can understand people's views better.
As for the planning issue, I don't know whether Ms. Chang or Mr. Chair would like to respond. For social welfare facilities and development, often new planning has not incorporated the need for adequate facilities. So for homes for the elderly, in the future planning criterion, would you really pay attention to the issue? Because there could be other kinds of services for the elderly, indeed, not just residential. There can be all types of services. Yes, Mr. Chair, as I said, ESPP, in view of the lack of planning standard based on population, the group had studied the need for care in the future and also the trend. And we also hope that there can be more elderly people continuing to live in their community. So they may not need to be accommodated in the home. We will try to help the elderly people remain in their community. Therefore, the group has proposed, based on various trends, an indicator for the plan that, and for other types of facilities, for the disabled and so forth. I'll ask my colleague to supplement. Yes. Ms. Poon, yeah, as for facilities for the disabled, as announced in the policy address later on, we will launch new plans under ESPP, and we will now put on record all the views collected, and later on we will enact a new plan. That is the RPP. What's the timetable? We will carry out our work in the later half of this year. And how long will it take? Well, we'll see how long it will take. That is, you don't have a timetable yet. All right, let me sum up here. For amending the ordinances, we've heard it loud and strong that the pace has been too slow. So I hope that the Assistant Director and the PS could really finish the work ASAP. I mean, it's really too long for the work to be done in 2 years. And you have to consult the public, you have to draft the legislation and take it to LegCo. It could take up to 3-4 years in total. We won't be here anymore by then. So I don't know how much longer it will take to sort out this livelihood issue. And there are also the views on the service quality group as well. People like to participate in it. So I think you need to open up the group to more people. The working group on the legislative amendment should also be more open to various parties. As for the content of the amendment, I think our subcommittee, the Joint Subcommittee on long-term care policy, can act as a platform. We can carry out a public hearing on the content for the legislative amendments. As for planning for long-term care, whether it's the planning criteria or long-term care facilities, welfare facilities, how these facilities can be planned for in new developments, I think this joint subcommittee can also discuss them. I hope that we can continue to be a platform for people to express their views. So I think deputations have expressed your views. You're not happy with the current situation. We've taken a small step, that is the amendment of the Code of Practice, where the working group has been set up 2 years after the scandals at the Cambridge home. We're seeing things happen on a snail pace, but anyway, thank you for your views. Meeting adjourned.